This video is part of the Alberta Healthy Living Program education series helping you feel better after COVID-19. This session reviews ways to manage changes in your cognition or thinking skills. Having challenges with cognition or thinking skills is one of the most common symptoms people deal with after they've been ill with COVID-19. Often people will describe their symptoms as brain fog. This can mean not thinking clearly, problems with memory, difficulties concentrating, or feeling like you're slow to process or recall information. The difficulties can also make writing or speaking more effortful. Like COVID, the symptoms of brain fog may be different for everyone who experiences it. People with COVID who needed to go to hospital frequently report some kind of cognitive impairment. However, a large number of those who did not need to go to hospital also have brain fog. The length of time the brain fog lasts varies from person to person. It may be a few weeks or it may be months. It can also come and go throughout your recovery. This symptom can be very troubling as it impacts you and your daily life as well as those around you, including your personal relationships and your work or school life. Anxiety or depression, as well as ongoing fatigue and additional life stressors, can make these cognitive symptoms worse. There are things we can do to help manage brain fog. Managing our general health can have a positive effect on our thinking skills, such as having healthy sleep habits to get quality sleep. You may notice you need more sleep and rest than before. Take care of your body with good nutrition and take your medications as prescribed. Managing your energy so you don't end up fatigued partway through the day is important. Cognitive activities take energy the same way physical activities do. Think about how you're spending your energy on both your mental and physical tasks. Plan to take short rests throughout the day to add to your energy reserves. Rest before you feel physical or mental fatigue. Using strategies and coping skills to manage your stress and mental health can also help your thinking skills. Stress can make brain fog symptoms worse, and it also uses up valuable energy. Other things you can do include keeping to a structured routine to keep activities consistent. Focus on one task at a time. Attempting to multitask can make your symptoms worse. Try to reduce any distractions and interruptions when you need to concentrate. To help manage changes in cognition, find strategies to help compensate in some of the areas you're struggling. Compensation strategies include making lists of things to do, setting alarms to help cue you for medications or get ready for appointments, making a daily schedule, and keeping to a regular routine. Ask family for reminders if needed. Take simple short notes or take pictures to jog your memory. Use sticky notes or phone alerts for reminders. Take a friend or family member to appointments and ask for written information so you can review it again later. It may help to take a bigger task and break them into smaller steps to complete them one at a time. Many people already have tools and strategies they regularly used prior to COVID-19. Keep using any tools that you're familiar with and have worked for you in the past. Be aware that lapses are normal. Fatigue and stress both contribute to lapses in attention and memory. Use tools and strategies to help you feel more in control. Another positive thing to do for your brain is gentle physical exercise and activity within the limits of your pain and fatigue. Try simple brain exercises such as puzzles, word games, memory games, and reading. Try a new hobby. Start with easy activities and slowly increase the level of difficulty when you feel ready. Ask for help when you need it. Plan ahead and have a strategy for stopping an activity when you feel overwhelmed or fatigued. For example, if you're going to attend a social gathering with extra noise and conversation, plan to stay only for a short time. Don't get too down on yourself if you struggle. It may take time to recover. Be sure to celebrate your successes. Don't overlook any progress that you've made. Try new strategies and find ones that work for you. Some reasons you should contact a healthcare provider include if your fatigue and thinking does not improve, gets worse over time, if you notice a new cognitive concern, or these issues are stopping you from going back to work or interfere with your roles and activities in life. If you're noticing changes with being able to communicate with others, such as difficulty expressing yourself or understanding information, If you, friends, or family feel that there are safety concerns because of the cognitive symptoms, for example, concerns managing your medication, driving, or cooking. If you find you're using unhealthy coping strategies such as substance abuse, or have pre-existing stressors that make these symptoms worse, family stressors, job loss, etc. You may benefit from further rehabilitation treatment in the community that can be arranged for you via your healthcare team. Connect with the Rehabilitation Advice Line for more suggestions and be sure to connect with your family doctor. This slide shows a list of resources anyone in Alberta can access online, as well as the contact number for the Rehabilitation Advice Line.